because it's time for a discussion round. So please welcome to the stage Magnus and Lillemor, Peter and Karin. Since this conference keeps on giving, I would like to introduce a third Peter as well. Peter Tyreholt, Chief Product Officer at Visiba Care. Do you find a table? Oh, Visiba can share a table. Yeah. Great. So, what do you envision? And the first one who is feeling like they want to respond to this, what do you envision will be the actual greatest impact of an information-driven healthcare system? I mean, what's really new? What will be the greatest impact? Go.
It forms a basis for change, because if you have information-driven care, what will happen is that you will release all the power that is within any organization, and in this matter, a care organization, to create change. Mm. Because if people don't know where, I mean, it's like when you do orientation. If you don't know where you are, how on earth are you going to know where to go? And if you have thousands of people in an organization and they all want to go in various directions, you have to create a common understanding of where you are, and then you can go. And I think that releasing that power of change is fantastic.
Yeah.
Yeah, I think the biggest difference will, or what will happen is the speed, because you would, if you can validate quickly through data that your change had this effect or that effect, you would get feedback maybe in days or weeks, instead of today. Often you need to do a research study, look at over several years. So you do a change, you implement it, and then you get the feedback 3 years later. Think of the difference when you actually get the feedback within weeks or within hours.
That's it. Yeah, great. And Lillemor, from your perspective from the municipality, how can we create information-driven healthcare in a safe and effective way to reach the right kind of impact? I mean, what is required for the city or municipality to have in place?
Oh, that's a very interesting question, because it's a lot of fear about this. Mm-hmm. A lot of people, politicians and decision makers are feared about this. What's going to happen when we share information in data? And I think we need brave politicians and decision makers that understand that we can't do the way we do today. We need to tear down the walls between the silos that we have today, and instead work networking together and we need also changes in the law. And I also questions who is doing the laws, who is decision about the laws. It's the politicians. So we need brave politicians in this, because I think that's the way to go for helping us. Yes.
But just to play the devil's advocate a little bit, don't they have a point though? Shouldn't you? Fear? Yeah, should be a little afraid.
Yes.
I mean, it has to be grounded in something.
Yes.
Why do you think they are why do you think they are afraid?
I think they are afraid because it's new,
okay.
And I think they don't really realize that we all also already have this data. We already have this statistic. We have a lot of statistic, and I don't think they really see the need in this and understand what we can do about this when we share it in this way instead.
Is that something the others have seen, the panel?
Yeah, in general, when you try to change something, especially when it comes with technology, then you're a lot worried about what can go wrong and where you can't apply it. Instead of looking at, I can apply it here, so let's start there, and then you can expand it the more you learn. And I also think a big difference between the public sector still and many of the private sector is this the ability to actually risk-free try to test things and know that you need to change it. We implemented digital meetings in healthcare, and the successful organizations within healthcare, it's the organizations that they start small, dare to try, learn something because it affects the organization in a different way than they thought, and then continue. So the worries before they start are never the same as when they started.
Right.
For when they started, it's completely different questions, and very seldom the questions they had before.
And would you say that Leap for Life and springboards might be a way to address this, maybe?
Perhaps, but I would just like to,
Sure.
to continue on the idea that you had, because of course at the moment we're talking about sharing data across across borders and trying to find out how to enrich our own our data by combining it. But again, starting small is a good idea, because you can actually derive quite a lot of insights of just using, for example, an AI on your own data, on your own municipal data. In the municipality where I live and where I work, we are actually trying to use a very simple AI to help the care workers identify which citizens they should take care of the first. And that is completely using the data that is already in the system.
Yes.
So that is a great and very, very easy step to actually go in the direction of using AIs, because already when people say AI, you kind of step back and say this is dangerous. But saying, well, it's our own data, it's the stuff that we already have, then you really are a step forward.
Yeah. Any other comments?
No, I mean, I can. You referred a little bit there to Leap for Life, and in that context, I see. I mean, the important one very important thing with Leap for Life is the stakeholders in the innovation system there, so we can tackle this question from all the different perspectives, and we all can gain from that. And that, I think we need to. I'm looking at you, Lillemor. We need to really address that with all the questions that we are going to work with in the future.
So returning to even if we have the data already, do you maybe particularly from a company perspective, so maybe Karin or Peter and so on, do you see any challenges with sharing data or proprietary algorithms and data that some companies might want to view them as assets they want to keep and not share? Is that an issue that you run into?
For us, that is not an issue. We firmly believe in an open system. I mean, the openness of data that has come around in the past 10 years is really the reason why there's such an explosion in development and innovation. So going back to being proprietary is not something for us. We believe in an open system, and we believe that our core strength will be to deploy the algorithms as such. And the data, that is not ours. The data belongs to the care system. So that is very clear. We do not have any data of our own. We have the tools for analyzing the data, deploying the algorithms. That's where we are. But
of course, the aggregated data is also data.
But that is not ours.
Okay, yeah.
Very clear.
Because I will let you in just a second, because I remember James Barlow mentioning the risk of having, for example, Google, Amazon, Alibaba, etc., taking over. And they sometimes also say that, well, the data is yours, but they can still make a lot of proprietary value out of data that they claim are ours. So is that a risk?
I don't see that. I mean, if you Google, they are a serious player. But because I was just about to say, if you're a serious player in this field, you can't act like that. And also sometimes we tend to discuss sort of the data about what we do on the internet in the same way as we discuss clinical data, and they're two different things. I think we need to separate that, and we need to understand that there have been business deals in the US where there are care providers that they want to store all their data on using the Google server services, and and they get that for free, and in return they give Google the access to do research on the data. So they've taken some conscious decisions, and I don't necessarily agree with those decisions. They're not in line with how we act here in Sweden. So I think we need to two different discussions.
And going back to what you said about politicians being a little bit skeptical maybe, or want to take it slow, maybe that's one issue that we need to make sure that those aspects are in place before we all of a sudden let a company take the data, for example. Is that?
I think this is the same question as we asked ourselves when we first began to take the paper into the systems, and we have the web applications, and we asked, it's going to be a risk here. Now they take the next step. So now we ask the same question as we did then. So step for step. Yes.
Sorry.
Now just a comment that the Google analog, that your individual data to Google has no value because it's first when you aggregate it. The same a little bit in the healthcare system, that for many of the things we talk about here, the information-driven healthcare, the individual patient's data is not valuable. It's when you do it in masses, and here we even see the problem between the regions. They want to sometimes customize just for themselves instead of looking that many of, if you take our product Red Robin, even Sweden with 10 million patients or inhabitants, it's very small if you want to do algorithm on very diseases that are very seldom occurring. So that perspective, that sometimes you need to aggregate to be able to create the value.
That's a good point, because hopefully we don't want a lot of data from sick people, because we want to have very few sick people, right? So we are working against our own desire for a lot of data, actually. So do you see any other challenges, such as lack of competencies, lack of data, adopting new ways of working?
I mean, from a university's perspective, constantly recruiting new people to our staff is a bottleneck, of course, and this field of information-driven care is a great opportunity for us, because here we can, our young new researchers that will have the possibility to work with really great things, supporting the population in the world and the welfare. So I think this is something that we constantly address, and we need to address it even more. And from a small university, we can actually give these young researchers a great platform to do international research together. We're really prestige universities outside Sweden. So I think this is a great opportunity for us.
So returning to the springboards, in what other contexts could springboards be used, do you think? Have you thought about that?
Well, as we had described today, the common springboard is when a company comes to us with an idea. It could be Visiba Care comes with an idea that they have already put a lot of effort in developing, and they want to get feedback from the users. But of course, we could flip it around and say that instead of coming with a fixed solution, we want to have the problem. So we can have the healthcare professionals coming in with the need instead, and do the springboard the other side around.
Okay.
So that could, of course, be a good context that we would like to do more. And talking about data, we could say, okay, we have this data. What can we do with it? So we can do it really flip the springboard around from the other.
Have you tried that? Have you had any experiences with that?
Not yet.
Okay,
But
well,
we're open for.
there you go.
We've actually done it.
Oh, you done it? Yeah.
Okay, tell us more, please.
Well, the basic idea was that the municipality was very interested in creating a more accessible city for their citizens, especially handicapped citizens. So what we did was that we invited quite a lot of handicapped citizens and asked them, what are your main problems when using the city? And of course, their basic idea, what they basically said was, well, we just want to be able to do whatever normal people do. And one of the ideas was that, well, actually, when you're using a wheelchair, if you've got problems going to the toilet. So it was basically, we want to be able to go into the city, use the city, and be able to go to the toilet. Well, basically the same that as everybody else does. So we started thinking, all right, should they be able to fly a toilet in, or what is going on here? But basically what we did from this discussion was to actually contact a producer of mobile toilets, and we've started to develop a mobile toilet that can be moved around the city and the whole municipality. You can have some, in the green areas, but when you have an event in the city, you could gather those toilets again, so the handicapped people can use it. And of course, if you have mobile toilets, you need to know where they are. So we need to develop an app that can tell you where are they, and you need to have an app for the persons in the municipality to actually find out how often are they used and stuff. So out of this, very broad question, we actually developed a very, very specific solution that makes good sense. And of course, the municipality said, yeah, all right, if we need mobile toilets, we want them to be beautiful and be able to have them integrated into the city. So there was a design element into this as well. So that was a pretty nice case, going from a need to a very, very specific, concrete solution.
Yeah, that rings true. That rings true.
I know this isn't AI or anything.
Well, it depends on what the AI predicts, I guess. Well, we have actually a question from the audience here on the Menti, so please keep the questions coming. On the connected person theme, will there be models where your lifestyle in the past will affect the treatment you get or the price you pay? Who wants to respond to that?
Isn't that a political decision? Really?
We should call in a politician then. Yeah. But what do you? Okay, so let me reframe it a little bit. Have you seen examples, or in your experiences with all these projects, have issues close to this come up?
No experience. I've seen in other industries that they have looked at it, but then often they already have had differentiated prices, but on some demographic stuff like insurance. There, exactly. Car insurance, you get different price depending on where you live, male, female, age, which is very unjust.
Because
building on that, on the insurance side again, I mean, you can today actually get a lower insurance if you have this little sender in the car that registers your driving, and depending on how you drive, you get a lower insurance. So there, and I think that is a choice. Do I want to have a lower insurance? Do I want to drive in that way? And I put the sender in. This other discussion, that is it's a big ethical discussion about it, that it requires its own day as such to be discussed, of course.
Maybe that's the theme for the next year's conference. Because I think it works the other way around as well, especially if you, let's say you have sensors in your body always on, so to speak. Maybe not just lowering the insurance rate because you drive well, but you could actually, if they predict that, well, there is a serious disease coming up here, maybe your insurance will be higher. And then we're in another ethical dilemma, right? So let's hope that politicians and philosophers and ethicists and others take care of this then.
No, sorry, but the problem is basically that when the data is there, then you start to think, well, how can we apply this? And then somebody will say, well, we need to hire the insurance prices, or we, from a public sector point of view, will go and say to your citizens, well, you need to change your behavior, smoking, whatever, or else we might not put you. We might delay our services or whatever. I know that it sounds evil, but.
But I have to ask: doesn't we already do like this? We tell the citizens don't smoke because we don't know that something bad happens to you. We tell the citizens. Do this, is going to be better for the municipality, do that, because we have numbers and data about this, so please, do like this instead. I think maybe we already do this, but we have to do it in another way. We have to ask the questions in another way.
But do you think...
in the future.
Yeah, but do you think there are data points that it sounds a little bit like after the fact, we kind of react to, oh, this got wrong, let's remedy it. Will there be some kind of data point that we can actually in advance say, we will never collect this kind of data? Or will we always be after the fact, reactive to stuff?
We have to ask these questions already. We need to ask these questions already, because in the social care, when we question the citizens about their problems, we already now stop in a moment that we says, no, we don't need to know this. Okay. Because we already ask a lot of questions to the citizens that we collect. Do we need all these questions and the answers? So already we ask the questions about this.
And do you think that stopping rule, so to speak, has that come all the way down to all the people working on these AI solutions? Are they aware of when to stop?
But I think I am in this working with the AI solutions. I am from the public sector. I am a social care and healthcare
so everyone can call you then. Everyone can call you and ask,
no,
is this the right...
I think I'm in the solutions, so I'm not beside and look at you and please help us. I'm in it. I'm working together with you. So I think we are already there.
Perfect.
Yes.
All right.
But you can see it from the other point. If you have, theoretically, you have all the information, are you obliged to tell the individual patient about it or not? So that's looking from the other point. So
so we have one question here. Can you comment on the success factors for managing change within the healthcare system? For example, with our staff and professionals. What are the success factors? Anyone?
I can answer again because I think the change management about this is more people are involved in the solutions, and they can see and they can react on the what's going to happen in the future. When we work together with the staff that is working directly to the patients or to the citizens, they are in it together with us much more than before. So I think it's good. That's a success.
And that goes back to the person-centered view that we've heard about, and the co-production, and also the implementation that we will hear about in section 4. So one final question. We're at the university now, and at this particular university we train nurses and the future global healthcare managers. What would you like the students and their teachers to focus on in their education? Should they change anything, or what do you think? To be more ready to be working with you guys?
Yeah, I think coming from, of course, implementing digital care, I think that needs to be that perspective, because meeting a person in person and meeting a person in video or in chat, you need to act in different ways. You can't do the examination in the same way. You need to get the patient to do the examination in some ways if you're a physiotherapist, for example. So really already today start learning meeting techniques, not just when you are in the same room, but when you actually are in the digital space. And then I also think, but probably too early to learn about, but in 5-10 years and a little bit already today, healthcare will get continuous data, but they are just used to using data points. So how do you apply in the healthcare delivery that you maybe have data which is a little bit less accurate, but you have it continuously? And that will, I think, be a huge change for healthcare, because they don't have the ability to use that today.
Yeah, because that would change a lot of the models. Yeah, Peter?
I would like the future nurses and healthcare professionals to be more creative and innovative, because they are the ones with the needs. They can see the needs every day in their daily jobs, and they will have to come up with the new ideas as well, and at least make sure they know where to go with the need to get new products and services developed.
Right. And of course, in an evidence-based paradigm, what we really need to speed up then, I imagine, is the way we can quickly verify these new ideas. Okay, and that you talked about the speed before. Yeah. Excellent. Sure.
Yeah, I have a somewhat conservative stance on this as well. Just to, because actually what you need to focus on is, of course, yes, healthcare will change and continuous data and all that, but the most important thing, as I see it, is that you actually educate great nurses who focus on healthcare and actually providing healthcare to the citizens, and actually being not being blinded by the technology, but saying, hey, stop. What we're doing here is that we're providing a service to the citizens, creating the best possible value outcome. So they need to be able to say, what is the value of whatever new technology that we're using, and say, well, we will go with this idea because it creates value to the citizen. I can see it makes a great solution. And they need to be able to say, no, this is not a great solution because what we're doing already is better. So having the ability to actually draw on the professionalism and say no or yes.
Yeah. Karin?
Just one thing to add there. I think especially with training at universities that brings about an authorization, you become an authorized, you get a title. The risk is that you stop, you go through that education and then you're done and then you go out to work. I think it's important for all young people and for all of us here to realize that we will have to continuously learn new things because it will change. The speed is so immense and we will have to retrain and rethink and be open-minded to new ideas how to solve the issues and problems at hand, because the solutions that we're talking about today, they will not be the ones that are really changing the world in 5 years or 10 years. They will be new ones, and that is what we need to prepare for and be continuously prepared for.
Yeah.
Yes,
Yep.
I like the things that you said, and I think they need to also understand that they have to work in teams, because there is to see what I do, you do, and you do together, we can make the solutions. And that I think they need to learn more in school before they come out to us, because today they come out, doctors, nurses, the other professionals, they are solitaires. So they are very good one person, but not together. So they need to learn to react together, and with the technical part of a university also. So they need to learn to work with them.
So a collaborative team player with
Yes.
an adaptive mind, being able to learn new things,
Yes.
but also have an understanding for their own professionalism, so they can say no to AI when needed. That's
Yes.
the profile
Yeah.
we need.
That's the
Okay, that's awesome.
That's easy. Yeah.
That's easy. Well,
That's what
thank you all. This has been very interesting.